My name is Dr. Miguelina Germán. I work for Montefiore Health System as a psychologist. And my experience with COVID-19 that I'm going to share with you today is my personal journey and story. And I just want to acknowledge that as a healthcare worker, many of us have had different stories and journeys with COVID-19. And this is my story, which is a story of hope. So one day I was at work sometime in March of 2020, and I had started to feel some body aches and I started to cough, and I worked pretty late that day, and by the time I got home and I took my temperature, it had spiked to over 100 degrees. So I immediately suspected that I had COVID-19. And during the week, we have a 2-bedroom modest apartment with 1 bathroom in Manhattan. And during the week, my fiance's mother stays with us to help us with our 2 children who are 5 and 12 years old. And she cooks meals for us and, just is a wonderful support to our family. So she was asleep when I got home, and I immediately went to wake up my fiance and to tell him that I suspected I had COVID-19 and that I was very, very scared for his mother's health, and that we needed to get her out of the apartment immediately. And so by the time we managed to do all of that, it was probably around midnight, and he drove his mother home. She has an apartment in Brooklyn. And over the course of the next week, I was lucky that my symptoms remained mild. But it was also challenging because my fiance also works for Montefiore Health System. And so he had to continue to go to work because March was really the peak of the crisis for Montefiore Health System. And so I was home with our children, and it was really difficult to maintain social distancing rules and the quarantine guidelines suggested by the CDC. That wasn't really feasible or realistic for us in a modest 2-bedroom apartment in Manhattan. And so I coped with that reality by telling myself that our children were healthy, they didn't have pre-existing conditions, that most of the statistics showed that, children were not being impacted, children who had profiles like them. And I took comfort in that. And then after about 10 days, I was cleared to go back to work. And then that week, my fiance started to show symptoms. And unfortunately, his course of COVID-19 was moderate. And that is what we're learning, that COVID-19 is impacting men with more severity than women on average. And so we had a tough couple of days where he had actually started to develop viral pneumonia. And I remember one night I was checking his vital signs every 2 to 3 hours. But his doctors were amazing and guided us through it. And I really got through that difficult week by leaning on my support system, my friends, my family. I think the challenging part about COVID-19 is if you have family, they want to support you, but if they're older or in those risk categories, as a healthcare worker, you're not going to let them. And so my friends really were the ones I had to probably lean on the most. And I remember this one day where I was just exhausted, and I realized I didn't have enough groceries in the house. And, I have some pride, and it's not always easy for me to ask for help. I think it's easier when people initiate or offer help, but I think asking a friend to go food shopping for me, I had to really swallow my pride and tell myself that I really needed the help. My family needed the help. And so I asked her if she could go food shopping. And of course she said yes, and, without hesitation, and, left the bags outside of our door. And so, I think leaning on your social support group and not being too prideful to ask for help is really how we got through it. And then eventually my fiance did get better. He probably took a little over 2 weeks to recover, and probably was at home for almost 3 weeks. But he's now back at work at Montefiore Health System, and our children are attending a New York City Department of Education rec center, which is how we're able to continue to go to work. And that's our story, which is really a story of hope. The way I tried to emotionally handle my diagnosis was I asked myself first, is this something that I have a lot of control over? The fact that I think I probably have COVID-19? Or is this something that I don't have a lot of control over and I just have to ride it out? So I decided that it was the former. I did not have a lot of control over the fact that I had the symptoms, and I was pretty convinced that when the test came back, it was going to be positive. And so, there's a technique I use when I have something very stressful in my life, but I don't have a lot of control over how to fix it or change it. And what I do is I visualize a box in my mind, and I let my mind just kind of freely flow. And any worry thoughts or any images, so for example, maybe a really painful image was me in the hospital, or a really painful thought might have been something like, what if my child contracts COVID-19 from me? And so I let all of those images and those thoughts that would really make me very anxious and very scared, I put them in the box. So I let them pop up in my mind, and then I visualize myself putting them in this box. And then I put the cover on the box. So for me, I visualize like a shoebox. I put the cover on nice and tight. I mentally pick up the box and I put it in a corner of my closet. And then what I do for the rest of the day is I really try to distract myself. And these are techniques that really helped me cope emotionally. And these are techniques that I would suggest to anyone who suspects they have COVID or they do have COVID. Because as we all know, it's really your own immune system that needs to combat COVID, as our doctors and scientists work really hard to find effective treatments. But for the most part, it's really your own immune system that has to fight it. And so managing your stress is important. And that's how I personally managed my time with COVID symptoms. I think when my fiance got COVID, initially I coped very similarly. I visualized the box. I put my, catastrophic thoughts and images into that box, and I put it in the closet. And I distracted myself. And that was working pretty well until I realized that his course of COVID-19 was not like mine, that his was more moderate, and we had a couple of very scary days. And so I remember the day, it was a Saturday, we were coming back from urgent care where he had gotten a chest x-ray done, and the doctor called him and told him that the chest x-ray showed that he had the beginning of viral pneumonia in his lungs. And so that overwhelmed my coping for a couple of hours, right? In that instance, the shoebox technique was not working anymore. And so what I did is, after I got him, set up in the bedroom and he had what he needed and he was resting, and I put a movie on for the kids, I went into the bathroom and I, took a shower and I let myself cry. And I cried for a long time, probably an hour. And I just let it out, and I gave myself permission to feel as terrified as I needed to feel, I had all these images in my mind of having to drop him off at the ED and not being able to go with him, of him being in ICU. And, I even let my mind go to the worst case scenario. And then I, pulled myself out of that, and I said, okay, no matter what happens, I'm going to be there for him. I'm going to be there for my family. I reached out to my immediate support group and I let them know what was going on with him. I let my immediate colleagues know, because in case I did have to take him to the hospital, I knew that I was going to have to take a few days off from work. So I let everybody know that needed to know, so I was kind of planning ahead for the worst case scenario. And then that didn't happen. Thank goodness. That's not our story. But emotionally, I would say that was the toughest part, was when he became ill and I realized that his course wasn't going to be like mine, that it was going to be more moderate or even severe, because at that point in time I didn't really know how his story was going to end. And I also had guilt because I'm pretty convinced I got him sick. And I'm just so grateful that he recovered and that our family story is one of survival. We feel very lucky. My best advice, if you have been diagnosed with COVID-19, just drawing upon my own personal experience, is share it with people that you feel safe and comfortable sharing it with. Don't put a lot of pressure on yourself to tell everybody if you're not ready to do so yet. I think the other piece of advice is really use your support system. And this is not a moment to be prideful, and please don't be afraid to ask for help. And I can share with everyone that there was one day in particular that I was pretty exhausted and just feeling stretched, trying to take care of myself, trying to take care of my children. And I realized we didn't have enough food in the house. And I didn't want to go food shopping because I was quarantining. And I didn't want to ask my fiance to go do it because he was at work. And so I reached out to a friend who lives in our neighborhood, and I asked her if she could go food shopping for us. And that was hard. I had to swallow my pride a little bit. I felt a little embarrassed, but I did it, and it was so incredibly helpful. I remember that night I made dinner, and I was only really able to do it because she had gone food shopping for us. And so that's my advice. I think, share the news with who you feel safe sharing the news. Draw on your support system, whether that be friends, whether that be family, whether that be your faith. I think in times of crisis, leaning on your different supports is critical. And that's how I got through it.